Good morning. My name is Lidia Sierpinska. I am representing Poland at the 8th edition of the World Congress on Infectious Diseases. In my talk, I will present the topic, Liver Cancer and Cirrhosis as a Complication of HCV Infection, Case Study. I emphasize that HCV infection is the etiological factor of hepatitis C. It poses a serious health and social problem for the Polish population. HCV virus was first isolated in 1989 through genetic methods. And here the credit went to American scientists together with an English scientist. I would like to point out that the only reservoir of the HCV virus and the source of infection is humans. Here are the characteristics of the HCV virus. The incubation period of the HCV virus is about 14 to 180 days. It is resistant to high temperatures and dies only at 140 degrees Celsius in the sterilization process. Outside the body, HCV can survive for up to 3 weeks. It is sensitive to chlorine and spirit-based disinfectants. It has a spherical structure with a particle diameter of about 50 nanometers. It is coated with a lipoprotein envelope. It is a single-stranded RNA virus and is twice the size of HBV. Here are more features of the virus. It replicates mainly in liver cells, hepatocytes, because HCV shows tropism to hepatocytes. Some glycoproteins of the HCV virus envelope fuse with the liver cell membrane. In addition, the virus resides in the spleen, pancreas, adrenal glands, brain, bone marrow, thyroid, lymph nodes, and also peripheral blood cells, lymphocytes, monocytes and macrophages. Estimates show that there are about 3,000 new infections per year in Poland. The number of deaths in Poland since 1997 is very high. The rates are very high. For example, in 1997 are 23 deaths, in 2000 are 52 deaths, in 2010 are 163 deaths, in 2017 are 173. Here are the routes of HCV infection. First of all, infection occurs through damage to the continuity of tissues during tattooing, acupuncture, during procedures at the hairdressers, at the beauticians, in relation to intravenous drug use, during childbirth, in connection with dialysis therapy, in connection with organ transplantation from an infected donor, through medical equipment such as a gastroscope contaminated with HCV. Infection can also occur through sexual contact with an infected partner and through blood contacts in various Here are people at risk of HCV infection, people who had blood or blood products transfusions before 1992. People who have been repeatedly hospitalized with surgeries and minor surgical procedures. such as nevus removal, tooth extraction, endoscopic examinations. People who have undergone hemodialysis, or with a history of hepatitis B. Intravenous drug users, those who use tattoo parlors, beauty salons, those with risky sexual encounters, and those who use shared cosmetic tools. But above all, healthcare workers are at risk. I point out that after the HCV virus enters the body, an infection develops, which can progress to an acute, initial phase, or go through an asymptomatic phase, which goes through a chronic phase over a long time. I point out that HCV infection can lead to dangerous liver complications, namely cirrhosis, or primary liver cancer. The above-mentioned complications were the motive for conducting the study using the case study method. Here is case 1. The purpose of this study was to analyze the individual medical records of a patient with primary liver cancer in terms of relationship with HCV infection. Here is the presentation of the case study. This was a 63-year-old man admitted to the Department of Surgery in 2019. He was admitted urgently because of severe pain under the right rib arch. The pain score was 10 on the VAS scale. The patient reported nausea, vomiting, discomfort due to a feeling of an enlarged liver, and had a lack of appetite. It was established that the patient had been diagnosed with hepatocellular carcinoma 3 months earlier, and therefore a liver lesion thermoablation procedure was performed. The thermoablation procedure was performed at temperatures up to 60 to 70 degrees. In addition, the patient was treated with daily chemotherapy. A computerized scan of the liver was performed, and it was determined that despite the thermoablation, a nodular lesion measuring 70 by 52 by 70 mm was detected in the caudal lobe of the liver. In addition, several smaller cancerous foci of up to 24 mm were detected in both lobes. Independently, there were enlarged lymph nodes in the hepatic hilum up to 10 mm and peritoneal fluid was detected. A test was performed for the level of anti-HCV antibodies. They were present. Hepatitis C was found to be associated with a history of HCV infection. The association of primary liver cancer with HCV infection was established. It was investigated that 20 years ago, in 1999, the patient had a hernia operation. The patient under study was treated conservatively for 1 week. The pain was relieved. Further outpatient treatment at an oncology clinic was recommended. Here is the second case. The purpose of the study was to analyze the individual medical records of a patient with cirrhosis for association with HCV infection. Here is the presentation of the second case study. This was a 36-year-old man admitted to the emergency room in 2023 for severe upper gastrointestinal hemorrhage with swelling of the lower limbs. The patient was vomiting fusiform bloody contents. He complained of severe right upper abdominal pain. For a week, the patient had been experiencing shortness of breath, pruritus, and yellowing of the skin. There were enlarged lymph nodes and enlargement of the abdominal circumference. It was established that prior to admission to the emergency room, the man experienced lack of appetite, malaise after eating, nausea, difficulty breathing, constipation, which prompted the patient to be tested for the presence of HCV genetic material. The result of the test by real-time PCR confirmed the presence of HCV virus in the peripheral blood. There was a high viral load, 316.779. This was the viral genotype 1b, which is most commonly diagnosed in Poland. In addition, in the presented case, the patient had an abdominal ultrasound. Attention was drawn to an enlarged liver with increased heterogeneous echo and unevenly bare contour with features of cirrhosis. In addition, a computerized abdominal examination was performed, which showed a significantly enlarged liver without focal changes. Ascites, pleural fluid, and an uneven outline of the liver with features of cirrhosis were found. From the history, it was established that the patient did not associate the circumstances of infection, had not undergone surgical procedures, and had no dental procedures. Numerous tattoos were visible on the patient's body. The patient admitted that he had used a tattoo parlor several times. This was a risk factor for HCV infection. The association of cirrhosis with HCV infection was established. The patient under study was treated conservatively for 18 days, pain was relieved, and the major problem was the treatment of ascites due to refractory ascites. Faced with this problem, a single therapeutic paracentesis was performed. 6 liters of clear fluid were drained from the abdominal cavity. The patient was advised to continue outpatient treatment at the hepatology clinic. Conclusion: HCV infection is a significant clinical, epidemiological, environmental, and social problem in Poland. On average, about 1.9% of the population is infected. In the 2 cases presented here, the association of advanced primary liver cancer and advanced cirrhosis with HCV infection was demonstrated. The presence of anti-HCV antibodies was laboratory confirmed. Early diagnosis of HCV infection and implementation of antiviral treatment can prevent the development of hepatocellular carcinoma or cirrhosis. Health education of the public is necessary in terms of risk factors for HCV infection in medical settings as well as in beauty salons and tattoo parlors. Thank you for attention.